We are continuing to break down nocturnal leg cramps with Dr. Kalani Brady. And as we learned in the last segment, it's a very common problem among adults. Dr. Brady said, in fact, some people unfortunately experience it every night.
Yes.
Okay. So what are some of the treatments? We talked about some of the causes, but what can you do?
Well, a good start would be adequate water for dehydration. A little exercise, not popping a sweat, but a little exercise to limber up your legs prior to bed may also help. And then there are some stretching exercises that we can do if you wish, and I can show you what stretching you can do prior to going to bed. In addition to that, shoes with firm support and limiting your alcohol and caffeine. You've heard that before for almost every problem we've discussed. And then, of course, calcium, which you should be taking anyway for prevention of osteoporosis.
I know that a lot of people ask about tonic water and drinking tonic water. Is that a way to treat leg cramps?
Yes.
Okay.
Vitamin B complex, vitamin E, and then tonic water, quinine. You can buy it at the supermarket or the drugstore. It's the little yellow bottle. The bottle has a yellow label on it. And drink that before bedtime, preferably without the gin for the reason we discussed before. And that may help leg cramps.
Okay, you talked about some exercises that people can do. First of all, is it before you even start feeling the cramps, or as soon as you start feeling the tightness, you can do these exercises?
I would say these are preventive exercises before you go to bed, hopefully to prevent the leg cramps.
Okay.
However, when you have the leg cramps, and I have had leg cramps, you get out of bed and basically you start walking to stretch out your legs, and the leg cramp goes away.
Okay, and then some other exercises that you wanted to show us?
Well, one is very simple toe touching, and this stretches out the calves and the thighs, and staying down, not bouncing, but staying down during the stretching exercise for 20 or 30 seconds would be a good one. Another one that you've probably seen runners do, pressing against a stop sign or a telephone pole, is where they set one leg back and notice that the foot is dorsiflexed, and then they stretch the foot and they stretch the leg.
So is your back leg straight?
Your back
Completely
leg should be straight.
Okay, and then you kind of lean in further.
Right.
Okay, and then you switch sides.
And then you switch sides.
And then how many times do you do the toe touching and the exercise that you just did?
Oh, I'd do it 5 to 10 times each.
5 to 10 times each, okay. And then so how are you diagnosed? How do you know if you actually have leg cramps, or maybe you just went a little too hard that one day on your cardio?
If you have persistent pain and spasm of your muscles, then you probably should see your doctor about it, because there are treatable conditions that we mentioned, like hypothyroidism, Parkinson's disease, dialysis, diabetes, that can prevent leg cramps. So the doctor's a good place to start. They'll probably ask you about those chronic diseases and about what medicines you're taking. In physical exam, they'll be looking for muscle strength and sensory examination of your legs and deep tendon reflexes, and most importantly perhaps is the pulses of your feet to find out if you're having a deficit in the amount of blood you're getting down to your legs. And then lab tests would include electrolytes, especially if you're on a water pill or a diuretic, or if you're on dialysis. Those are very important. And if you're pregnant, up high, and you have these leg cramps, checking a magnesium to make sure the magnesium is high enough. Doing that, the doctor can use a bunch of prescription medications that may be somewhat effective in treating the leg cramps or preventing them.
Okay, so leg cramps, good to know. And you'll be back next week, Thursday.
Right, adult immunization, adult vaccines.
Wow, and you never think about it. When you think about vaccines, you think about just children, but adults, there's specific adult vaccines for us.
Absolutely.
All right, look forward to that. Seeing you next week, and have a good weekend, Dr. Brady.
Thank you, you too.
Thank you.
And go Mariota.
That's right, all right.